Good day, hello. Are you part of a training or assessment center and looking for ways to get the best out of your assessments for the candidates who are assessed and for your own center? Well, in this video, I provide a few tips for performance assessment at the level of cohorts of candidates and at the level of individual candidates. My name is Jimmy Lapping. I'm a psychologist and statistician with an interest in a wide variety of research topics, including teaching, learning, and assessment. And this video is part of a channel I opened 2 months ago and on which I regularly share videos on topics related to education, psychology, healthcare, analytics, writing, and financial markets. So in this video, I focus on an example of performance assessment in healthcare, because healthcare is a setting in which I've had several roles, teaching, assessment, research, innovation, management. In the past, more than 10 years of my career, but you can apply the principles of this example to other settings of performance assessment as well. So what you see here is a network of correlations between a total of 36 ratings, assessment ratings, of aspects of the performance of a medical student of a total of 6 different stations that this student completed. The network on the left and on the right is the same. Only the colors of the nodes differ because on the left we distinguish between aspects, whereas on the right we distinguish between stations. So each station simulates an encounter with a patient, usually an extra. Sometimes can also be a real patient who is given a paper and trained into that role of patient in the station. Who presents a problem, and the student has a total of 15 minutes to take the history of the patient and perform an examination. Then another 15 minutes to engage in an analysis, which is also referred to as clinical reasoning, and prepare a management plan, which is then discussed with the examiner or assessor of the station during the next 15 minutes. So these in total 45 minutes result in an assessment of 5 domains: history, examination, analysis, management, and relation, as well as an overall assessment, which is the 6th aspect of performance. Overall assessment provided independent of the domain ratings in order to capture aspects of the performance which may not perfectly match with the 5 domains but are important for good patient care. On each of these 6 aspects, higher ratings are better. Blue lines indicate positive correlations. Red lines, which are not present now, they would have indicated negative correlations. Here all correlations are positive, hence only blue lines. And thicker lines indicate stronger correlations than thinner lines. So here we see a structure that is quite common in this kind of station exams, which in medical schools are often referred to as, well, in some cases, objective structured clinical examinations, or OSCEs. In other schools, depending on how these stations are set up and how long they take, but usually when it's like of this kind of length, sometimes they are referred to as OSLERs, objective structured long examination records. And that correlations, while within stations here, they tend to be stronger than correlations between stations. So this is important. This has 2 important implications for the design and reporting of these assessments. To start, reliability coefficients per station will be higher than reliability coefficients per aspect or domain. You will get better values per station because of the higher intercorrelation within station. And related to this, you will normally be able to achieve acceptable overall reliability with maybe 6 stations, or occasionally even fewer if you use this type of domain-based assessments, which the same, I mean, with the same combination of ratings within each station, yeah. Whereas if you used only one rating per station, you might need many more stations in order to achieve acceptable reliability, potentially easily more than 12 stations. Finally, another advantage of domain-based performance assessment is that it provides a structure to examiners to explain their ratings through domain-specific feedback to the candidate. And although I said that the candidates assessed here are students, you should know that this kind of exam also exists for high-stakes assessments in which the candidates assessed are professionals. So, of course, as always, under the condition that examiners are appropriately trained in this type of assessment, the superior psychometric domain-based assessment structure can also help the center and other stakeholders to acquire statistics regarding differences in performance between stations as well as between domains, and whether differences between domains differ significantly across stations, chart on the left, or not, chart on the right. And knowing how different stations and domains perform is important to understand key features of the current assessment and the cohort that has undertaken the assessment, and may also inform future assessments or perhaps innovations of specific training activities. Next, from the perspective of one or multiple cohorts of candidates, a carefully trained and well implemented domain-based assessment system can provide information regarding possible subgroups of candidates in terms of either overall performance or performance on specific stations or domains. And where standards need to be defined in order to make informed decisions regarding whether or not individual candidates pass an exam or not, or pass an assessment or not, the domain-based approach presented in this video can help to define a reliable standard using a method known as borderline regression. The vertical axis of the charts here expresses the percentage of the sum of domain ratings of a station relative to the maximum possible sum of domain ratings for that station. And on the vertical axis, you see that the station overall rating consists of 4 categories. 1 indicating poor or below standard, 0 indicating borderline or nearly at the expected standard, but with minor lapses that would not really have consequences for patient care. 1 indicating satisfactory overall performance, and 2 indicating an excellent overall performance. Borderline regression is about finding the intercept of the regression line with the borderline overall category, so here the 0 category, and here in both charts that would be around 57%. The difference between both models is that on the left we assume a linear relation between domain scores and overall ratings, whereas on the right we assume a quadratic relation between domain scores and overall ratings. Although many places use classical ordinary least squares regression, linear regression, for this exercise, I personally prefer 2-level models. You don't see the levels in this chart, but what the outcomes here in these charts are the result of 2-level modeling, in which candidate and station are treated as hierarchical levels. And candidate level random intercepts constitute a random effect to be accounted for. The rationale for this is that, for instance, if we have 400 students who each complete 6 stations, then classical ordinary least squares regression treats the data as if 2,400 students each completed 1 station, whereas the 2-level alternative that I use for this kind of exercise correctly accounts for the data structure of 400 students who completed 6 stations each. And finally, regardless of whether we set a standard using an empirical cohort-based approach such as borderline regression, or we use a hard and a priori criterion to make progression decisions regarding individual candidates, since a domain-based structure with 5 domain ratings and 1 overall rating per station over 6 stations provides a total of 30, 6 times 5, 30 domain ratings per individual, we have quite a bit of information at the individual level regarding the consistency or a lack of consistency in performance across stations and within domain. Here, for instance, we see a struggling student whose performance also fluctuates a little bit from station to station. The scores on the vertical axis here represent domain ratings, with 1 or 2 indicating below standard performance, 3 representing borderline performance, 4 indicating satisfactory performance, and 5 and 6 indicating a performance that is above or well above the expected standard. So the red dots for this candidate indicate a total of 10 poor ratings, whereas we have only 9 of the 30 ratings at the satisfactory level, and the remaining 11 ratings are borderline. This is clearly a candidate who struggles, really a borderline candidate. And with the aforementioned borderline regression method, this candidate would normally land below the standard and hence have to prepare for a next occasion of the exam, in many programs also referred to as a resit. Here we have another candidate who performs visibly better than the first candidate we just saw. Here we have only 2 moments of observed poor performance, another 6 at borderline, and hence the vast majority of ratings, about 73% to be precise, at or above the expected level. This candidate would normally pass if the borderline regression method was used. And finally, here we have an example of a good candidate whose performance is consistently at, above, or even well above the standard. For this candidate, the overall station ratings will normally also be all at least satisfactory, and possibly in 1 or 2 stations excellent. And this is the kind of student who, in the vast majority of assessment programs that require all candidates to undergo the full assessment, provides a performance trajectory that in a sequential assessment would probably result in the candidate having to undertake only part of the assessment. I am not diving into sequential assessment in this video because that would make this video a bit lengthy, but I do have a few videos on my channel in which I explain the principle of sequential assessment and how a sequential approach can help to reduce assessment resources for candidates who are clearly above the standard, such as this example here, or also for candidates who are clearly below the standards, would be something worse than the first candidate we saw, and for which therefore decision making should not be that difficult. To at the same time use the assessment resources needed to get sufficient information for candidates whose performance is around the standard, so more borderline or in between borderline and satisfactory, and for whom decision making requires more information. Okay, that's it for this video. I hope you find this useful, and if you have any ideas or suggestions for future videos, feel free to leave a comment below this video or contact me via lappinganalytics@gmail.com, and you can also find Lapping Analytics on X, former Twitter, under this name. Thank you for listening and see you soon.